The Genuine Article. Discussion and commentary based on articles from JACC.
Hello, I'm Tony DeMaria, the editor of JACC, and I'm here with another edition of Inside JACC, and I'm talking to Dr. Laurent Bonello, and Dr. Bonello is on the faculty of the University of Marseille, the North Hospital of Marseille, actually, and he's just about to publish a really interesting article in JACC that deals with the pleiotropic effects of Clopidogrel. Laurent, can you tell us about your study? Why did you do it?
Well, our team has been very involved both in endothelial function monitoring during PCI and in P2 wild-type adipose receptor blockers. And this time we wanted to look at the global picture to change a little bit our point of view.
Okay, so as I recall, what you elected to do was to look at a group of patients who were undergoing PCI and to look at endothelial cells, circulating endothelial cells, as a marker of the damage that occurred with PCI, and to look at patients relative to the degree of platelet inhibition produced by Clopidogrel. Is that correct?
That's exactly correct. And you know that circulating endothelial cells are a very good marker of the lesion that is going on during PCI, and it is a good prognostic marker. So we would like to measure them and look at them in view of the P2 wild-type adipose receptor inhibition in these patients.
Excellent. So what did you find?
Well, we found a very interesting result, because we found that they correlated. The less platelet activity inhibition you get, the more lesion you have during PCI. And this is a very important issue, because you know that ion treatment platelet reactivity has been associated with a poor prognosis in patients undergoing PCI. So we may be looking at a global picture, and this may be very interesting.
So now what you found was that the more Clopidogrel inhibition that occurred, the lesser number of circulating endothelial cells, the lesser amount of endothelial damage. Do you know the mechanism involved here?
No, we didn't look at the mechanism at this time, but there are some evidence that this may be an indirect issue, because there have been publications on P2 wild-type deficient mice, and they've shown that this was probably related to interaction between platelets and the endothelial cells.
Now, how about, did you follow these patients out to see if the degree of circulating endothelial cells correlated with some clinical event, some adverse event?
This is a very interesting question, and we are currently looking at the analysis. This is a world program on endothelial cells, endothelial progenitor cells, and platelet reactivity, and we are just now collecting the 1-year follow-up.
Did you find in this study any evidence that the timing of Clopidogrel administration made a difference in the degree of endothelial damage?
No, because in the study design, all patients had Clopidogrel loading dose of 600 milligrams, 12 hours at least before PCI. So we were not looking at these different time points.
Well, this is really fascinating information. It adds to the body of information about the pleiotropic effects of Clopidogrel, the anti-inflammatory effects, the perhaps vasodilator effects, perhaps nitric oxide. So we find that really what seems to be a simple drug, just inhibition of the platelet receptor, is maybe more complicated than that.
Exactly, and this is very interesting now that because we have new drugs, and we have seen with some of these drugs some pleiotropic effects which have a very high impact on the prognosis, like with ticagrelor, and this may be another way to look at these drugs.
Sure. Well, thanks very much for being with us.
Thank you.
For Inside JACC, I'm Tony DeMaria.